Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Researchers compare strategies for identifying which patients should undergo genetic testing for Lynch syndrome, the most common form of hereditary colorectal cancer, in a study published in the Journal of the American Medical Association. Here is some information about Lynch syndrome. It is an inherited genetic mutation that is associated with an increased risk of developing colorectal, as well as some other cancers. It is estimated that about 3% of colorectal cancers are caused by this syndrome. In families with Lynch syndrome, colorectal cancer typically occurs more frequently and is diagnosed at a younger age than in the general population. Researchers from the University of Barcelona looked at multiple strategies that have been considered to help identify those most likely to have Lynch syndrome among a group of more than 10,000 unrelated individuals who were newly diagnosed with colorectal cancer. These strategies take into account such factors as personal and family history of colorectal cancer and other cancers, as well as age of the diagnosis. The investigators also evaluated the risk of genetic testing to determine definitively who had Lynch syndrome. Universally screening everyone with colorectal cancer caught more cases of Lynch syndrome than any of the strategies aimed at identifying the most likely candidates. While universal screening caught all cases of Lynch syndrome, the other strategies was missed between 5 and 15% of cases. Missing such cases would mean that efforts aimed at prevention or early treatment of colorectal cancer could not be implemented in a timely fashion. It would also mean that the relatives of those who failed to be identified with Lynch syndrome would not know to be tested. Today's research suggests that universal genetic screening of all patients with colorectal cancer for Lynch syndrome might be beneficial and cost-effective, considering the impact it could have not only on the patients, but on their relatives, who may also have the mutation. Additional research is needed to confirm these findings. For Insider Medicine in Depth, I'm Dr. Susan Sharma.